A lot of change can happen in 50 years. Children grow up, families get bigger, and memories are made. Healthcare itself has changed in the last 50 years, and we are happy to have been part of it. Creating programs that help change the lives of those using it and being part of the memories our patients and clients share. Here at Shawnee Health, our goal has always been to improve the health of Southern Illinois. Beginning as a group of concerned leaders, Shawnee Health Service original board was established to bridge the gap in healthcare availability across the entire region. This began through collectively developing what would be known today as a Health Maintenance Organization, or HMO. As time went on, our board began to look at other healthcare issues in the Southern Illinois area. It became apparent that there needed to be an organization that looked at those issues in a structured way, had access to money to make it possible, and developed solutions that kept the community's best interest in mind. One of the first healthcare problems Shawnee's board became aware of early on was the lack of healthcare provided to the increasing number of migrant farm workers in Jackson, Union, and Johnson counties.
Over time, there became a major stream of workers coming through Southern Illinois. They, in general, had no mechanism for obtaining health services. We just started with the bare basics, and I don't recall exactly how the bus was found, but somehow we came into the possession of an old school bus. And the services were provided by resident physicians from the residency program at the School of Medicine in Carbondale. The bus was modified so that there was an exam table. There was a place to do a little intake and to do vital signs like blood pressures and temperatures and that sort of thing. This was our first foray into providing medical services to farm workers.
In 1974, we were working with the Southern Illinois Planning Commission and conducting focus groups with members of Franklin and Williamson County. It became apparent that respiratory diseases in those areas were an ongoing health issue, due mainly to underground coal mining. At the time, there was no one in the area who was sufficiently qualified to identify and treat those diseases. The Carbondale Clinic had recruited a physician from Minneapolis who had just finished his training with the Mayo Clinic. And he was a board-certified pulmonologist. His name was Parviz Sinjabi.
The hard part was convincing local physicians that this was an asset to the area. But that changed, I think, primarily because Dr. Sinjabi was a great physician, a compassionate human being, and he worked well with area physicians.
Dr. Sinjabi made it possible to identify and diagnose black lung disease among other various respiratory diseases miners were plagued with within the industry. This enabled miners to successfully apply for federal black lung benefits.
I never really thought of the safety issues that would be involved. I guess I just thought that everything was going to be okay, that I was diagnosed with black lung. That was in 2002, and they've just kind of swept it underneath the rug. Shawnee Health has bent over backwards to help me, and I appreciate that very much. I just couldn't have done it by myself. It's a plus to have a program like this for the coal miners. We need somebody to help back us up. We can't do it alone.
We work with the leaders of small communities like Hearst, Grand Tower, and Elkville to see what small but operable healthcare system could be developed. We wanted to not only increase the access to primary care, but a model of primary care that included counselors and mental health staff as an integrated model of healthcare.
I think one of the biggest reasons for Shawnee's success over the years was our community partnerships, the relationships we developed with hospital administrators, with health department administrators and their staffs. And I think just being true to our mission.
We worked with established medical providers to help staff these rural clinics, which then allowed us to build relationships that would eventually carry over to them joining Shawnee or allowing us to carry on their practices upon retirement from medicine.
Dr. Herbert Fine was a huge player in us coming to Carterville. And over time, it took a long time to earn Dr. Fine's trust before he finally did decide that there were young physicians now in Carterville that could do the job.
In the late 70s, we realized that there was a large underserved population of young women and children across Southern Illinois. There was a lack of both OBGYN as well as pediatric services for young moms post-delivery.
There was data to support that adolescents were not using primary health care clinics. Too old for the pediatrician, too young for the internist. Teenagers don't always confide in their parents when they have something that concerns them.
They know me since I was a kid. They knew my mother, they knew my sisters. And just to, come into Shawnee and have nurses when they were younger, help watch them in the hallway where mom had to be taken care of, it was a family environment. So kind and just inviting always.
Over the next decade, as we continued to grow, it became necessary to expand and build new health centers in locations that needed it most.
We knew right away we could easily set up a location in Grand Tower, as we already had a place where we were visiting to do the screening services. We began immediately then to look for a location in Murfreesboro. The health center really in Murfreesboro just really took off and very quickly worked with the mayor of the community of Hearst and Franklin Williamson Bi-County Health Department to establish a site in Hearst. And it wasn't terribly long after the Hearst Center developed that people in Carterville wanted services.
There was a push in the 80s by the state of Illinois to provide alternatives to nursing home placement. They realized that there were many benefits to keeping older adults in their own homes, namely better quality of life as well as the cost efficiencies. There needed to be an independent agency that could connect older adults with various resources needed to provide in-home care. And that is what led to the development of the Shawnee Alliance Social Service Division we have today.
We started from scratch creating a different division with the community care program when we became the care coordination unit. And we started assuming the responsibilities almost county by county.
A large part of it was to have a single point of entry, providing comprehensive services and bringing into the care plans comprehensive services regardless of who provided them. And the long-term goal was to prevent premature or inappropriate nursing home placement and help older adults remain where they really want to be, and that's in their own home and in their own community.
Apart from our adolescent health center, there were not many providers in the area able to address low-income women's health needs in Southern Illinois. We needed to create an OBGYN health center that was available for all women, regardless of age or ability to pay.
There was a time when there wasn't a physician in Southern Illinois who would see a woman who was pregnant on public aid, regardless of age. It wasn't just teenagers. We would provide the nursing staff, we would provide outreach staff. It worked. A lot of women got care. We even extended the upper age limit at the adolescent center so that we could accommodate more women.
As we became aware of the shortage of dental providers accepting Medicaid, it only made sense to bring that service to the community.
In this region, very few private dentists accept Medicaid patients. So we were seeing a tremendous number of people, and kids particularly. Children in need of pediatric dental services were having to travel over 150 miles to get that care, and that is unacceptable to us. It sets the tone for an entire child's educational advancement. What is the future of Shawnee? And one thing I think is really important is about Shawnee that has guided us through the years is that we develop a strategic plan and we live and breathe the strategic plan. I see us trying to expand our services to meet the needs of the patients where there's holes, things that are so out of the realm of healthcare, but so really important to the development of human being. That's Shawnee's future, not traditional medicine.
I think the biggest key to our success is the staff that we've been able to have work with us.
It's a people who believe in the mission, the people who say, yes, this is the important thing to do. You have to have a passion to do the kind of job that our staff do every day. And so that's a big thank you to all of you.
To everyone who has been part of our story, thank you. We look forward to the next 50 years.